Ask the Doc is proudly brought to you by the Australian Digital Health Agency.
All right, let's ask the Doc, and let's kick it off with a question about updating My Health info. Why is it important, Doc, that we do make sure that we keep our details up to date on My Health record?
Yeah, well, so with the My Health record, one of the interesting parts about it is being able to get notifications when things are being uploaded into your My Health record. I mean, there has never been a time in history where if a note was put down or a prescription was dispensed or an allergy or an immunisation, and all of a sudden you were told it's part of your medical history now. And I think we need to understand that the value of that medical information, knowing when notifications have been sent to you, information's been added, who's actually who you've authorised to be able to have access to your My Health record. All that just comes down to us, taking more ownership over the management of our health. And to be able to actively manage your health, you have to understand where your information is, and that's where the My Health record comes in.
Super. Thank you. Now to a question about the coronavirus vaccine. Helen asked, does the vaccine in any way affect fertility?
Yeah, so a lot of misinformation about everything going on to do with the vaccinations at the moment, and one of them was to do with the fertility and the impacts. The British Fertility Society has come out in the British Medical Journal and said categorically there is no impact. The studies have shown at the moment that the coronavirus vaccine, based on test and research, doesn't show any impact on fertility, and theoretically there's no real reason why it would. So it's one thing to be able to understand that this is a new vaccine, but it's not a new type of vaccine. We've had these types of vaccines being distributed for other coronaviruses in the past, and so at the moment the advice is that it does not impact on fertility.
Good to know. Heather asks, what is the best way to find out food allergies, besides eating it, of course?
Yeah, well, I mean, that's a risky way to find out that you've got especially if it's a severe food allergy. The skin prick test is the gold standard when it comes to trying to figure out whether you're have an allergic reaction to a certain type of food. So basically, that's usually run by a qualified dietitian or an immunologist or somebody who can do those tests. They put a small little scratch under the skin of a whole series of different types of foods or parts of foods. And then if you have an allergic reaction to that, it's not a life-threatening reaction, but then they can understand whether you've got an allergy. So that is the most comprehensive and the gold standard. When you start looking at food intolerances, they can also be managed through an elimination type approach, reintroduced, but it has to be controlled, and that's usually run by an accredited dietitian. So they can actually do it in such a way to try to figure out you're allergic to that or you've got an intolerance to certain types of food. People can try to do that at home themselves, but there is a bit of science behind it. So if you're having a hard time, it's best just to get the experts to do it for you.
Great stuff. Sorry, I was trying not to laugh at this one. Filippo asked, St. Patrick's Day is coming up. Can we kiss on the day?
I'm married, Filippo. So, I don't think we will be kissing.
Good.
Oh, wait, you want to know whether
Is this a
not
date
Filippo. I mean, I don't know. I thought it was just a weird...
I mean, are you into it? Or?
I have no problem, but, that's a great question. I feel like that's what we should see more of on Ask the Doc. These very hard...
Proposals?
You can kiss. But there's obviously risks associated with kissing. It depends on who you're kissing, what you're kissing. You pass all types of concerning diseases, including coronavirus.
Yeah, exactly. There you go, Filippo, you creep. I'm only joking. Good,
Enterprising, I think you would prefer. Doc, it's always great to see you. Thank you so much. And for more information, make sure you head to digitalhealth.gov.au.
Great stuff. Thanks, Doc. Now, still to come, what happens when our Daniel Doody meets up with John Paul Young? We'll take you there very soon.
But next, Olympian Gian Rooney is